Are you coughing up blood? Are you having fevers or chills or night sweats? Are you losing weight? Have you been exposed to sick people? If so, you may have signs of a serious illness. Hi, I'm Dr. Naznin Jamal. I'm a board-certified internal medicine physician, and my goal is to empower you and your loved ones in better recognizing diseases and medical concepts. So let's begin. Hemoptysis refers to the coughing up of blood in your phlegm or sputum. Now, the blood can vary from just a slight tinge of pink with white or clear colored mucus to full-blown blood that looks like jam or jelly. You could cough up maybe teaspoons worth to as much as a cup. It is a medical emergency, and so if it happens, you need to present to the emergency department. Hemoptysis can occur in quite a few diseases, including tuberculosis, or better known as TB. Although it's rare, we do often see it. Cancer can cause coughing up of blood. Autoimmune conditions in which your body is attacking itself can be genetically inherited or at times present de novo. And then finally, blood clots such as pulmonary emboli can also cause hemoptysis. Now, what tests are needed? Well, the first thing before drawing any tests is your physician's going to talk with you and perform a history. They're going to want to know some specific things. They're going to ask you about whether or not you have fevers, chills, night sweats. They're going to see if you've been losing weight or if you've been exposed to someone who's been sick or has had TB. They'll also ask about your travel history. They'll ask about your family history when it comes to cancers or other autoimmune conditions. They'll even ask whether or not you may have risk factors for developing a pulmonary emboli. Pay attention to my pulmonary emboli video for more information on that. After they perform a basic history, they're going to examine you, and sometimes the physical exam is unrevealing. They'll move on to blood tests and order quite a plethora of tests, such as a CBC, which is a complete blood count. They want to take a look at your white blood cells and see if they're elevated, which could indicate an infection. They want to take a look at your hemoglobin, hematocrit, to see if you have an anemia. They'll take a look at your platelets too to see if they're playing a role. They'll look at your electrolytes to see if there's any sodium abnormalities or kidney dysfunction. They'll take a look at some clotting tests. They may even take a look at blood cultures, which do take time to come back. Usually around 48 hours or so, you begin to see something. After the blood test, they will be checking a chest x-ray. And if the chest x-ray doesn't give very much information, they will move on to a CT scan of your chest. Let's say all of these do not give the doctor an answer. Then what they may do next is consult a pulmonologist, which is a lung specialist, to perform a bronchoscopy. A bronchoscopy is a procedure where you're put to sleep for, and what they do is they take an endoscopy, there's a camera at the other end, and they go inside your lungs to take a look. Not only are they going to visually inspect how your lung airways look like, they may end up performing a biopsy, and they'll collect some samples as well. The samples that they collect will be sent to the microbiology department to take a look and evaluate for fungal and TB elements. They'll also be looking at bacterial elements as well. Now, if they perform a biopsy, that's going to be sent to the pathology department, and often the pathologist will look for cancer. Hemoptysis can occur in a wide variety of conditions, but they all need to be investigated for and diagnosed early. So if you're coughing up blood, please seek emergent medical care. Until next time.